Hello my people, I welcome you to Agbogidi page today once more. Welcome. Today we'll continue with our teaching on complications of personality disorder. Untreated personality disorder can result in great personal and social costs, including lost productivity, hospitalization, significant unhappiness, and imprisonment. All these things are what the complications of personality disorder can lead us to. That is why it is necessary that once a personality disorder is discovered, the next is to think about how this personality disorder can be treated, how the problem of personality disorder can be solved. If there is any sign, any symptom of a disorder in a person's personality, it is expected that the person should go for a cure, for a treatment. Because if a disorder is not treated earlier, it can result to so many things. It can result to a complication. And that complication will now result in great personal and social cost. Those personal and social costs will include the lost productivity. This person may lose his or her job through a personality disorder he is suffering from. This person may be hospitalized for life due to a personality disorder he or she is suffering from. This person can be seen always unhappy. A significant unhappiness may be discovered in the life of this person. There will be no atom of happiness again in the life of this person because of what? A personality disorder that he is suffering from, that she is suffering from. This person may be living a life of imprisonment. You know, most of the time people suffer from this personality disorder. The disorder used to scare some of their friends away. You know, one of the worst things that may happen to you in this life is when you have no friend. So, if a disorder should scare your friends away from you, you will be seen as a person living in prison. So that is why once the symptoms of a disorder is seen in a person, the person is expected to go for a therapy or a treatment. So people with untreated personality disorder are at the risk of alcohol or drug abuse and violent or self-destructive behavior, even suicide. Yes. A person suffering from personality disorder that is not treated is not expected to be taking alcohol. You know that alcohol has a connection with our brain. So this alcohol that has a connection to our brain, that is why whenever you take an alcohol, you become toxic. So, the toxic nature of alcohol that destroys our brain at the moment we take it. There is no way you tell me that all these people who become toxic at the time of taking alcohol, that they are always accurate. No. Sometimes they act accurately. Sometimes again, some of them do not act accurately. Because there is a slight destruction to their brain at that moment they have taken the alcohol. The next is drug abuse. If a person with personality disorder indulges him or herself in drug abuse, the drug will go and affect the brain of this person. This person already has a disorder. So he or she is not expected again to go for more destruction to the brain again. The person is not expected to take more drugs again, because the drug will still go on and continue to destroy the brain. Another risk that may be seen when a personality disorder is not treated is the risk of what? Violence. Most of these people that suffer from personality disorder do engage themselves or do experience violence. Most of them are violent in life. Any slightest act from another person to them, everywhere is flamed up. So, if you should have a person of serious schizoid personality disorder, or serious paranoid personality disorder, or serious obsessive compulsive personality disorder, or serious schizotypal personality disorder, you will discover that if the disorder has gone deeper in their life, they will not forget or they will not forgive whatever act of yours to them. They will always see it as an attack, so they will like to retaliate, and that is when violence sets in. Another risk that may be coming from untreated personality disorder is self-destructive behavior. This person is no more happy with his or her life. So the happiness is no more there. And because this happiness is deprived from the life of this person will always like to experience self-destructive behavior. One of the destructive behavior that may be coming at the thought of this person is what? Suicide. Let me commit suicide and be deleted from this world. That is why it is not expected for you to keep sharp objects around a person suffering from any of the personality disorders we have discussed. Because when this personality disorder is not treated or not well treated, this person may resort to destructing him or herself. And then this destruction may lead to what? Death, a loss of life. So that is why we encourage you, if you have anybody suffering from any of these personality disorders we have discussed, please do the person a favor by taking the person to a psychologist or a psychiatrist for a therapy or treatment. When a counseling is given to this person at the initial stage of this disorder, I believe this person will be cured. The life of this person will be restored again. Thank you for listening to our today's class. Thank you for being with us. Bye.